Do that, they found that we're actually getting better CPR competency, especially with the new guidelines. We found out that doing CPR on the mannequin with the immediate feedback, objective feedback, not subjective, would encourage the learner and teach the learner to press harder, press faster, and to more competently do CPR. These are voice-activated mannequins. As you do the program, you're going to find that you're getting feedback, and so you may have to adjust your volume here on your speakers. It's going to eliminate the need now for you to schedule for a class. You can come in here and do it anytime that you're ready. Now, I'm assuming since you're here, you've already completed part one. Part one of the course is completely online. So I've got us in demo mode, so let's get started and see how this works. So you're going to click on your program, and there's an 8-digit code that is found on part one of your certificate. So you do need to find that 8-digit code on your certificate, and then you'll enter it into part two, and that will put you into the program. And it will say mannequin or instructor, and you're going to push mannequin. Then the next question will come up. It's going to ask you if you're going to use a bag mask device or if you're going to use a pocket mask. We're asking that the nurses would use the bag mask, but if you have a lot of trouble, you may use the pocket mask, and I'm going to show you where they are. They're right here in this blue box, and you would just take one of these out, open it up like this, and then you could use a mask, put it on our mannequin guy, and you can blow right into the mannequin that way. First of all, I'm going to demonstrate the bag mask way to do it.
Do 60 compressions on the mannequin. The
Okay.
computer will instruct you during the exercise. Please pay attention to the instructions, but do not stop performing compressions.
I recommend that everyone uses a step stool. Listen to the instructions. Don't start until the voice tells you to start when you are ready. Now, I have a metronome here, and if you push the red button, it's set at 100, and that's about how many compressions that we need to be doing per minute. So let me take off my badge. And so this is a demonstration of how to do compressions properly. You want to compress with the ball of your hand, keep these fingers up out of the way, and you want to go mid-chest, and you want the mannequin to the very edge of the bed so that you're actually over. And in real CPR, this is exactly how you would do it. It looks like this.
That's right. You are doing well. Very good. Place your hands a little lower on the chest. You are doing well. Very
There.
good.
What do you think? So every time that the metronome swings, you do a compression, and you're listening to the advice. He did advise me once. He said, put my hands a little lower. So you make minor adjustments and you continue the compressions. The first part of the test is just that. It's compressions only. The second part of the test is ventilations only. And the third part of the test is actually CPR, where you put compressions and ventilations together. You may find the mannequin with a shirt on. You need to always open it up for CPR, just like you would in real life. Let's take a look now at the ventilations. Always press the green check mark. The slide will come up. It'll have a green check mark and a red X, because there's no penalty not for passing, and you may pass and you didn't realize it. Always stop when the voice tells you you may continue to practice or stop. When you hear that, stop. Otherwise, you're going to flat wear yourself out, and there's no benefit to that.
Do 12 ventilations on the mannequin. The computer will instruct you during the exercise. Please pay attention to the instructions, but do not stop performing ventilations.
All right, so we're going to do bag mask ventilations. The narrow part of the mask would go on the nose, the wider part over the mouth. The C would press down on the mask tightly, and the E brings the chin up. And you want to give the the bag a nice slow squeeze. And let go.
Wow.
Very good.
Great.
He liked that one. The first one he said more air. Pay attention to his instructions.
Great.
5 seconds between breaths.
Great.
2, 3, 4, 5.
You are doing well. You are doing well.
Now if you were going to do blow in, it would look like this. Press the mask down, chin up.
Ventilate a bit more often.
I waited too long.
Very good. Very good.
And you're going to be looking for the chest rise. 5 seconds between breaths.
Slightly increased ventilation.
I waited too long.
Good.
Okay, I think you get the drift of that. Let's go to CPR. One thing to tell you, you must count in CPR. It's 30 to 2, remember, and you don't have to wait the 5 seconds between the breaths in CPR. The 30 is not, you're not going to get credit if it's 29 or 31. You got to count 30.
Perform CPR on the mannequin. First 30 compressions and then 2 ventilations on the mannequin. Continue switching back and forth between 30 compressions and 2 ventilations. The computer will instruct you during the exercise. Please pay attention to the instructions, but do not stop performing CPR. Start when you are ready.
That's your cue to begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Good.
4, 5, 6, 7, 8, 9, 10. Come to the head of the bed. Sit your mask. Nice breath.
You are doing well.
Get your own breath. And give another one. And then go right back to CPR.
Good.
4, 5, 6, 7, 8, and on. It will take you through 3 cycles. Good CPR for 3 cycles, and the instructor inside the course will pass you. All right. That pretty much is the way that we would do it on the adult mannequin, and now for BLS you have to do the infant also. So I'll